Safety is an important aspect of quality in healthcare. When you consider safety of perioperative patients, there are multiple factors that are involved, which could be preoperative factors, intraoperative factors, and postoperative factors. Serious adverse events do occur in the surgical patients. Fire in operation theatre is one such incident that needs a special mention. We are never prepared for a fire in the operating room. We will be showing you how to deal with the fire in the operating room.
Who bleeding? Your BP is falling.
Sister, just retract this. A lot of bowel adhesions are there. Who bleed marate patient? Anesthetist, how is the BP?
Patient's BP is falling.
It's too much. Mop the sister अपने mop दिया.
I started blood.
Suture दे माला suture दिया. Doctor suture दिया.
Suturing. हाँ, suture material. BP still falling.
क्या लोग को suture?
सर इधर फायर लग रही है.
Suture कराओ लग रहा है.
सर फायर लग रही है.
Suture कराओ लग रहा है.
बेटा, please go and inform sister in charge and ask her to activate code red.
हाँ काय झालं
कोड रेड ऍक्टिवेट करा प्लीज.
हाँ सिस्टर मी कोड रेड ऍक्टिवेट करते तोपर्यंत हे थांबवा ऑपरेशन थांबवा आणि फायर एक्सटिंग्विशर घ्या 2111 हॅलो कोड रेड OT1 थर्ड फ्लोर हॅलो कोड रेड OT1 थर्ड फ्लोर कोड रेड OT1 थर्ड फ्लोर
हेलो हाँ सर ओल्ड बिल्डिंग थर्ड फ्लोर OT कॉम्प्लेक्स यस सर कोड रेड या
I'm switching off oxygen and I'm switching off nitrous. I'll just start on air. I'll ventilate with medical air. मामा बाहेरून ऑक्सिजनचा मेन ऑफ करा या ओटीच्या बाहेरचा.
Pack it. Wet mop द्या. Okay.
फायर विझत नाहीये. दूसरा अजून एक एक्सटिंग्विशर घेऊन येता का?
हाँ इधर मैडम दूसरा घेऊन येते.
तर असं पण करू. उबड. And patient is really sick.
Right,
There's
right.
hypotension, there's tachycardia. I've already started blood, NORAD.
evacuate the patient.
Yeah.
Call for the trolley.
Okay.
Call for the trolley. How is the patient? How is the pulse?
It's weak, low volume, tachycardia is there.
Okay. Yeah, do you have any help? Where is your?
No, I've been asking, but कोणी येत नाहीये.
Okay, we'll just first shift the patient and then see for the bleeding.
Okay.
Let's ask for more blood.
I've asked
by
for,
then.
yeah, I've asked for trolley.
Right.
We'll shift.
Right.
Yeah.
Okay.
आपण आता फ्री ऑफ मध्ये हलवूया पेशंटला पहिलं. सिस्टर आपल्याला शिफ्ट करायचं बाहेर, इथे आग विझत नाहीये. मी मामांना ऑलरेडी सांगितले लवकर त्यांना ट्रॉली घेऊन पाठवा कारण बाहेर आपल्याला शिफ्ट करायचंय.
Hold it.
Yeah. 1, 2, 3. एक मिनिट मला माझा जरा ड्रग ट्रे घेऊ दे.
हम लोग कंटिन्यू हम लोग.
या प्लीज मॉनिटर मिळालं नाही का? मॉनिटर नाहीये. तिथे मी हँडल पल्स ठेवलेला आहे.
Doctor Ji, how is the patient?
नाही ही इज व्हेरी सिक. बीपी इज फॉलिंग. मॉनिटर नाहीये आणि मी घेतलेलं मी सगळे सिरिंजेस घेतलेत आणि फायर कंटेन होत नाहीये. शॅल वी गो टू कॅथ लॅब बिकॉज इज रियल.
हॅलो सर रेड कोड ॲक्टिवेट झालेला आहे OT
one technician who was on duty is missing. So can you just go and check? But you have to take safety precautions. Please go safely and come back.
ओके मैं
And
फायर
see
मार्शल को
whether
लेके जाता हूँ अंदर चेक करने के लिए. उनके मतलब कपड़े कैसे थे? टेक्नीशियन का ड्रेस है वगैरह?
हाँ, टेक्नीशियन का ग्रे कलर का ड्रेस था
ठीक
उनका.
है ठीक थैंक यू. ठीक है प्रवीण तू राइट साइड चेक कर, मी लेफ्ट साइड चेक करतोय. जर तुला काय सापडेल तर लगेच मला कॉल कर.
Sir, come immediately. It's bleeding a lot. All the mobs are sore.
फास्ट.
Artificial.
हार्ट डिपॉझिट द्या. लोकल हार्ट डिपॉझिट द्या.
प्लीज पुश ब्लड आणि लेट्स कनेक्ट बाय वेन्स. ओके, लेट्स वेंटिलेट विद वेन्स
फुल
नाउ.
मॉप द्या सिस्टर.
ब्लड और पुश करना पड़ेगा. नॉरेट बढ़ाओ.
पटकन स्विचर द्या.
नॉरेट मध्ये वाढवला डोस. 20 ml का.
BP is controlled now.
BP is improving.
Okay.
It is 90 systolic. It's coming up.
Have you ligated the bleeder?
या.
Okay.
Hemodynamic seems to be settled now. Heart rate has come down to 94 and BP is also come up to 100/70.
Good.
Saturation is also good.
Okay.
Yeah.
Madam, please give one more shot of antibiotic. There is a breaching
Okay.
infection protocol, so we
Yeah.
need to repeat the antibiotic.
Okay. Divendu, please दे देना.
Okay.
Done?
Ma'am, antibiotic given.
एक मिनिट शांत थांबा. शांत एक मिनिट सगळ्यांनी शांत थांबा. 1 मिनिट ऐकून घ्या फक्त. OT 1 मध्ये आग लागलेली होती. छोटीशी आग होती. ती आग आता आटोक्यात आणलेली आहे आणि आपले जे तुमचे सगळ्यांचे ऑपरेशन चालले होते सर्जरी त्यांना व्यवस्थित बाहेर काढलं होतं आणि त्या दुसऱ्या 3 नंबर वॉर्डला नाही पेशंट तुम्हाला 1-2 मिनिट तुम्हाला दाखवू. तो OT 1 मधलं जे पेशंट होतं ना त्या पेशंटची सर्जरी आता परत सुरू झालेली आहे. एक फक्त आपला मामा तिथं अडकला होता त्याला आपण काढलेलं आहे. आता कुठलाही धोका नाही आणि आपलं जे बाळाची सर्जरी होती त्याची सर्जरी आपण पोस्टपोन केलेली उद्या होईल. नाही एमर्जन्सी नाही आहे. क्लोज रिडक्शन होता. उद्या ती सकाळी घेऊ आपण त्याला. उद्या होईल आणि तुमच्या OT 1 मध्ये जी सर्जरी चालू होती ती आता परत आपण सुरू केलेली आहे. थोडे वेळ फक्त थांबवली होती. त्याला पॅक करून परत सर्जरी सुरू केलेली आहे. त्यामुळं घाबरण्याचं काही कारण नाही आहे. सगळे पेशंट स्टेबल आणि स्थिर आहेत आणि थोड्या वेळात तुम्हाला सगळ्यांना भेटायला मिळेल.
Fire mock drill is an exercise which we conduct at Bharti Hospital every monthly. Activation of the code red in such situation is a very important measure. Actually pay attention to the patients because all patients are vulnerable patients. The patients might be under anesthesia, the patients are intubated, the surgery is going on, the surgeon might be at the critical step of the surgery. Fire drill in the simulation department or in the simulation lab, we can actually exercise each and every detail related to the fire drill in a controlled environment. If we consider fire triad, that is the fuel, oxidizer and the ignition source, it is present in ample amount in the operating room. If we consider fuel, the drapes in the OT, the disinfectants, the cloths and the mops act as a fuel. Cautery, laser, defibrillator pads, burr hole, etc. can be an ignition source, while oxygen and nitrous oxide act as an oxidizer, and they can come together leading to fire event. RACE is an acronym that we usually use in the fire, which also holds true in the operating room fires. That is, rescue the people that are involved, raise the alarm, contain the fire to prevent the spread, and evacuate the people. ASA Task Force guidelines, which were published in 2013, actually gave us the report and of prevention and management of operating room fires. It gives us the practice advisory for prevention and management of operating room fires. If we consider operation theatre fires, they are of two types: the fires that are involving patient and fires that are in the operating room. The fires that involve the patient are again of two types: the airway fire and non-airway fires. For any fire situation in the operating room, things that should be available in the OT are saline, fire extinguisher, alternate tubes and masks, fiber optic bronchoscope, and alternative drapes and sponges. The management of the airway fires include: one should stop all the gases, remove tracheal tube if it is already present, irrigate the airway with normal saline, remove inflammable particles, flammable particles like smoke residues from the airway. To prevent the airway fire, one can fill the ETT cuff with saline and use laser resistant tracheal tubes in case of laser surgeries. What should we do in case of operation theatre fire? The first and the foremost important thing is stop the surgery. Anesthetist is usually the team leader for evacuation, and therefore the evacuation plan should be readily available in the operating room. Priority should be given to evacuation even if the surgeon is at the most crucial step of the surgery. Refer to the fire evacuation plan that is displayed in the OT. Patient under general anesthesia should be switched to medical air, or FiO2 should be less than 30% as been advised by the ASA Task Force guidelines. One should know about the oxygen shut-off valve and electrical main switch in case of fire. Again, the service continuity after the fire is extinguished is very important. Let's see how many adverse events or adverse outcome can occur after the fire and what all post-fire care is needed after the OT fire incident. There could be burns or inhalational injuries. There could be breach in the infection control protocol, and therefore the patient needs to be given additional antibiotic prophylaxis. There could be disfigurement of the patient or OT personnel, or a death incident can also be there. The psychological trauma is never actually dealt with, but there could be a serious psychological trauma that could occur after the fire event. The patient might need prolonged hospitalization, and there could be additional resource utilization like additional surgery, etc. The present surgery could be postponed, cancelled, or prolonged, and this has to be taken care of after the fire is extinguished. If required, the nearest fire extinguishing center should be intimated. ASA Task Force actually advises the fire risk timeout for all the cases that involve cautery or laser, and also the cases that are involving head, neck, face, and upper chest surgery when the airway is nearer to the area of surgery for risk of cautery fire. Forewarned is forearmed. Implementing the fire drills actually helps us to be ready and to be more prepared to deal with such an adverse incident in the operating room. The safety of the surgical patients is everybody's responsibility, including surgeon, anesthesiologist, and nursing staff. The journey of the patient who is posted for surgery should be made as safe as possible, and that should be our ultimate goal. Thank you.